at rest. Okay, so let's look at these sounds. Okay, vertical dimension of rest. Okay, what is it? It's the relationship of the jaws at rest with no tooth contact, habitual postural position. It's neutral, unstrained. Okay, unstrained position. What we typically use, okay, is we ask the patient to wet their lips and repeatedly pronounce the word M or Emma or mama. Okay, so what I want them to do is take their lips and wet them with their tongue and then repeat mama. When the patient has rehearsed this, ask them to stop all movements when the lips touch. At that time, you measure the points of reference. Okay, so what I end up doing is I place a dot on their nose, a dot on their chin. We mark it at biting, then we have them say those words and we measure the distance and it tells us the space. Okay, very simple method for a quick identification of the rest position. Okay, then we look at the anatomy. Fairly constant position is the incisive papilla, okay, due to the resorption pattern. Okay, the labial surface of the central incisors in a denture should be 8 to 10 millimeters anterior to the middle papilla. Tips of the canine should be set on a horizontal line which pass through the posterior border of the incisive papilla. Why is this important? Because traditional guidelines tell us that when the patient makes the F sound, the incisal edge should touch the vermilion border of the lower lip. Once the incisal edge position has been established, the length for the central incisors is determined. So with the anatomy and function, we can start looking at how much tooth display we can truly functionally give. Okay, that patient. The proper anterior posterior positioning of the incisal tip is largely determined by the opposing dentition. Here we have control because we're doing upper and lower teeth, which plays a vital role in the amount of overjet and overbite. Okay, the labial dental consonants F and V. Okay, when an F sounds like a V, the maxillary anterior teeth are too long. Okay, it's really important to understand that. Hey, what I typically have them do is say the word very funny, and I listen. Okay, if the F and the V sound slurred, we ask the patient, what do you sound like to yourself? And we start moving those teeth around and have them repeatedly say it. Okay, the production of CH, S, and J sound brings the anterior teeth close together. When correctly placed, the lower incisors should move forward to a position nearly directly under and almost touching the upper incisors. Okay, if the distance is too large, it means that too small of a vertical dimension of occlusion may have been established. Okay, if the anterior teeth touch when these sounds are made, the vertical dimension of occlusion is probably too great. So quick identifiers using a couple words gives us a lot of information. Okay, and what we're looking for is a correct vertical. When we're increased, there's clicking. Okay, there's discomfort to the patient. They're under strain. When they're overclosed, we have that denture look. There could be pain in the TMJ. They might have angular cheilitis of their corners of the mouth. So there's a lot of key factors.